students to complete the required clinical hours in the spring so they could graduate and or progress to the next semester. And that they were allowed up to 50% simulation substitution for traditional clinical hours and at a 2-to-1 ratio substitution. And also I'd like for you to know, and you already know, Mississippi Institutions of Higher Learning require all state-approved nursing programs to maintain accreditation by a national nursing accrediting body. You have the list of schools and the type of degree programs that are scheduled for site visits during this upcoming academic year. The national accrediting bodies, along with IHL, will be conducting virtual site visits for the fall with the type of spring visit to be determined, which, as we know, travel for all within and out of state is limited due to COVID. So this will be a new opportunity for a type of visit that may turn into something that could be cost effective in the future. So you have the list of information of the site visits coming up. Also, I want to share with you changes in nurse administrators for the schools of nursing that has occurred. Alcorn State University, Dr. Linda Godley is the interim dean of nursing. At Northwest Mississippi Community College, Miss Lacey Gentry is the director of the nursing program. And the University of Southern Mississippi, Dr. Lachelle Story is the Dean of Nursing at Southern. The annual nursing report for the Mississippi nursing degree programs, you can find that full report on our IHL website and information related to the IHL Board of Trustees meeting that's occurred this past May for the annual accreditation of the schools. And I also attached you a document that's also posted on the IHL website, the results of the May site visits regarding the status of the schools of nursing for their accreditation. So a bound copy of the annual report will be provided to you for the board members and the board staff at a later time when our print shop is back up and running. We're working on limited individuals in the building, just like you all are. Just to give you a brief overview of state registered nursing programs, there are 23 schools of nursing in the state that offer over 40 degree programs with multiple entry points. And the types of the programs and the types of institutions are listed on your report. I'd like to share some selected data from the full nursing report regarding admissions, enrollment, and graduation. They indicate that during academic year 18 and 19, there were 3,958 admissions. The overall total of nursing admissions has decreased by a negative 5.4% from academic year 14-15 to academic year 18-19. That's a 5-year period. Associate, baccalaureate, and master's programs have decreased, whereas doctoral programs have increased. And this information I'm sharing with you that's not listed on your one-page report, it's in our full report. During the fall of 2019, there were 5,991 students enrolled in all degree programs. Nursing enrollment has slightly increased by 2.1% in the past 5 years, with all degree programs showing an increase except in master's programs. During academic year 18 and 19, there were 2,908 graduates. Nursing graduates have increased by 6.5% over the past 5 years, with most of the increase seen in the baccalaureate and doctoral programs. I do want to share with you again, unfortunately, there were no nursing education loan scholarships awarded for the past 3 years due to the lack of legislative funding. There's no new information related to whether we will have further funding at any given time. I would like to express my appreciation to the Office of Nursing Workforce for providing scholarships and other funding to the state schools of nursing for the past several years. We really do appreciate the funding. Lastly, thank you to the board members and the board staff for all you've done for practicing nurses and our nursing graduates in addressing the ongoing COVID-19 pandemic related healthcare issues in our state. Thank you so, so much. Do y'all have any questions at this time related to the report?
Thank you, Dr. McCord.
Thank you very much.
Ms. Malone, are you on?
Teresa was having some difficulty. She texted me, Alton, that she was not going to give a report. I think she is listening, so I don't think she's going to be able to give a report today. And also, Ms. Linda Shouts, I think through one of our board members, Sandra Culpepper, had only some information to pass on. Is that correct, Sandra?
That is correct. We want to make sure that the LPNs of Mississippi knew that the 2021 Mississippi LPN Association will not be having their convention due to the pandemic. And as well, the National Association as well has declined to have their convention in October as well.
Thank you.
20 for the national convention, 2020 has been canceled. And then for the state association, 21 is canceled.
Anybody else in the public? If not, we'll move on to the Office of Nursing Workforce.
All right, thank you, Mr. President. Good morning, everybody. I'd like to start with an update on the joint data project we've been working on for about 8 months, and we did actually receive a draft last weekend, and this week we had some meetings, and we're doing a number of edits. We're rewriting some narrative sections and adding some additional infographics because we feel as though that will be an advantage to our audience. It will be available in an electronic format on the website, and we will also have some printed copies. So hopefully within the next couple of weeks, we'll have a finished product. We did submit the USDA Distance Learning and Telemedicine Grant. Was submitted, I believe, on July the 10th. Only information I know about the decision will come between September and November. So we'll eagerly await that decision. 2021 scholarships. We've received all the applications back from the schools of nursing and have prepared a draft distribution schedule that we're studying and may make some additional changes or recommendations, and look forward to having a motion at the next meeting. We're finishing up with ONW projects from last year currently. We're still involved with, I believe we have one more faculty simulation training webinar with MAST at UMC, and that's been going well. I was going to thank Dr. King last week for participating and presenting in our last webinar with the American Heart Association. She did a great job and appreciate that. That's really the update from last month. Are there any questions?
Any questions? Any questions at this time? Thank you, sir.
Thank you.
All right, moving on to board business. Have a motion to approve the minutes from the business Zoom meeting on June 19th, 2020. Make the motion to approve. Motion TJ Adams. Second, Dr. Owens. All in favor? Aye. Any opposed? Motion carries. Agreed settlement proposal minutes of June 20th. Have a motion, we approve those agreed settlement proposals. Motion from Laura Moore. Second is Brandy Taylor. All in favor? Any opposed? Motion carries. I'd like to waive the reading of the names on motions. I have a motion for that. Motion Brandy Taylor, second from Ms. Shirley Jackson. All in favor? Any opposed? Motion. Future meetings, we have agreed settlement proposals, October 6, 2020. Disciplinary hearings, October 7th and 8th, 2020, starting at 8:30 a.m. The business meeting will be October 9th, 2020 at 11:05 a.m. The panel for disciplinary hearings during this time will be Ms. Sandra Culpepper, Dr. Melissa King, Nancy Johnson, Ms. Laura Moore. Just to give an update, there was conversation with legal about possibly adding in another hearing date between now and then because of the amount of cases that are coming up. But that's something that Brett will be getting back with us on in the recommendations for that. But maybe reaching out to some people for another call. Legislation, Trey couldn't be here today. He did provide a written summary of the different legislative actions we had to go through, pass and fail. Just want to draw your attention to a few of them. The revised public notice, you'll notice number 2 there, was changed to where it doesn't have to be mailed out, but it could be other types of communication. Our appropriations bill, everybody that worked on that, thank you very much. We were cut some, you'll see the numbers there. Considering the current situation that we're in our state and nation, it was a very positive outcome. So thank the people that worked on that. And at the very end, something that changed with OLRC, they modified the language to where previously they reviewed any new or proposed changes. They modified that to where they could review any of the, basically anything they need to as far as existing regulations. It's not just new proposed regulations, it's any regulation that can be reviewed through LRC. The other ones are in there, so you can kind of read over those. Just wanted to point those out. Now we move on to executive director report. Dr. Johnson.
Okay, good morning, everyone. This will be brief. First of all, I just want to say a thank you to all the nurses that are out there continuing to work and provide that compassionate care in these unprecedented times. I am very proud to be a member of that noble profession, and I salute them and continue to offer my prayers for them and their families as we move through this time. Secondarily, I'd also like to thank my staff for the hard work they continue to do. As we go through these uncharted waters, the Board of Nursing continues to fulfill the mission, and it's only through the efforts of such dedicated and committed staff. So I appreciate them. I'm only as good as they are. I really, really appreciate them. A couple of things I wanted to bring to your attention. As board members, the annual NCSBN meeting will be conducted August 12th. It will be virtual only. It will be conducted from 1 to 5 p.m. Registration is free. The delegates today, the deadline, however, is August the 5th. I thought it was today, but the deadline is August the 5th. So if you have not registered and you wish to attend the virtual meeting, you may do so on the website, ncsbn.org website. Please feel free to do that. If you need any assistance, please let myself or Vanessa Gray know, and we will be happy to assist you with that. The delegates should have received or will receive their orientation packet today. As a matter of fact, it was emailed from NCSBN. So make sure that you check your emails, and our delegates will be Sandra Culpepper, Tina Hatfield, with alternate delegates, Dr. Mary Stewart and Dr. Priscilla Burks. So there's information that should be in your emails this afternoon. So please make sure that you govern yourselves accordingly to that. The Compact Commission annual meeting will be conducted on August the 11th from 9 to 12. It will be virtual as well. Registration deadline for that is August 4th. So if you're interested in attending, please, the same website, ncsbn.org, and you can register to attend the virtual commission meeting on that date. I did want to also bring your attention to one of the items, temporary permits that we have been able to issue. Basically, we have approximately 1,300 temporary permits, and I did find some new numbers here that were in my office that were ran as of yesterday, I believe. RNs, we have 918, LPNs 300, CRNAs 8, and nurse practitioners 145. So well over 1,300 temporary permits have been issued. I bring that to your attention because those permits were for 120 days. Most of those individuals will be expiring the end of this month. So we'll bring it before the board. And I know that will be talked about later on during the meeting to request an additional 120-day extension so that individuals can continue to work. This is due in part to some of the NCLEX exams being scheduled for August and September and even further out. And this will allow those individuals to continue to work while they are preparing for their NCLEX exams. I have also provided an annual report that looks at the business of the board that you have in your packet as well. The staff have worked diligently on that. So if you have any questions about any information that's in that report, feel free to let me know. In addition, you know, fingerprinting has been an issue nationally as well as here at the board. Some states are no longer doing fingerprints. Some have contracted those out, and it still remains an issue due to COVID-19. However, I am happy to report that we here at the Board of Nursing will start doing fingerprints. I believe it's next week. Information should go out on our website the first part of that week if it's not already out there. Everything will be strictly online as far as scheduling, and we will be adhering to strict social distancing guidelines as well as the number of people that will be allowed in the building at any given time to get their fingerprints done. So I ask that our stakeholders be patient with us. These again are uncharted waters, but we are going to start the fingerprinting process so that these individuals can be licensed. Once they pass the NCLEX, as well as our reinstatements, some of those are only waiting on fingerprints. So this will afford them the opportunity also to go ahead and get fingerprinted and get their license versus working on a permit. And at this point, that's all I have, unless you have any questions. I will pass it over to Shan to do the budget report and talk about our appropriations bill.
Okay.
Questions, Dr.
Okay. Yes, on our budget, so far, we just closed out the fiscal year 20. We are now beginning fiscal year 21. We do have approximately $5,327,000, $296.96 available in the Board of Nursing's budget. We will wrap up, hopefully, once all invoices have come into the board with closing out fiscal year 20. All invoices have to be into the Department of Finance no later than August 10th, if I'm not mistaken. So we should have our end of year fiscal year totals by that date. We will begin dispersing funds from fiscal year 21 as invoices are already rolling in. So I should have an updated budget for you once we start receiving those invoices. We will also begin fiscal year 22's budget preparation. You'll receive that information from me over the next week for any input, any projects, programs that you all want to start looking at for fiscal year 22. I'll send that information out via email over the next week. We have to have that back into the board by August 10th. As the budget this year for fiscal year 22 will be due August 17th. So that gives me a week to kind of put together whatever thoughts that you all may want to start for fiscal year 22. But if you can get it to me sooner, that would be great. But any questions about the budget fiscal year 21 or 22?
There are no questions. I would like to have a motion to approve. Motion, Brandon Taylor. Second, Dr. Stewart. All in favor? Any opposed? Motion carries. Committee reports. Executive committee. Would like to ask for a motion to approve the executive director's annual. Motion, Lauren Moore. Second, Ms. Collins. All in favor? Any opposed? Motion carries. Second, in the position of treasurer, as required of surety bond. Dr. Melissa King took that position over, so just ask a motion to approve the surety bond as the position of treasurer. Motion, Blake Ward, second, Ms. Shirley Jackson, all in favor? We have one administrative denial. Case number 2020-0130. Ask for a motion that we approve that administrative assignment. Motion TJ Adams, second Dr. Stanford. All in favor? Any opposed? Motion carries. October and December virtual hearings. This is to be able to carry on with the next two hearing dates. As we have this one, I would also add into this motion and any other special called hearing during this time. I have a motion, we approve those virtual meetings. Motion from Dr. Owens, second. Dr. Stewart, all in favor? Motion carries. Any opposed? Extend the 120-day emergency disaster permit. As Dr. Johnson just spoke, this will expire July 31st. This extends it another 120 days for the people that are currently graduates and not been able to take the test, as long as people from out of state come in and practice this time. Let's have a motion. We extend the 120-day emergency disaster permit. Motion from Mr. Ward, second. Dr. Stewart, all in favor? Aye. Motion. Any opposed? Motion carries. All right. Any other board business? Now we'll move on to compliance committee.
All right, thank you, Mr. President. I move that the board adopt the Compliance Committee's recommendation to deny modification of license number R865621, final order dated February 12th, 2019, to remove Chemical Dependency Unit, CDU, from the respondent's prohibited areas of practice for the first 24 months of being licensed as a nurse with probation.
We have a motion on the table. Do I have a second? Second, Ms. Laura Moore. All in favor? Any opposed? Motion carries. Any other business?
Thank you, Mr. President.
Advanced practice.
We have nothing to bring forward.
Nurse practice.
We don't have a motion, Mr. President, but I did want to give just a brief report that the practice committee did meet today, and as we had indicated at the last meeting, we reviewed evidence on decision-making frameworks to guide scope of practice. The committee fully supports this model, which is endorsed by the NCSBN, AACN, ANA, AONE, NLN, and many other boards of nursing. We will be seeking to include and collaborate with the APRN committee, as well as the director of advanced practice moving forward, and we'll have an update on that progress at the next meeting.
Thank you.
Questions?
Definitely look forward to that. All right, other committee business. The Administrative Code Ad Hoc Committee is now being chaired by Dr. Melissa Keene. I know during the last two meetings, there have not been any, during the last board business meeting, yet, so we'll get updated at the next meeting. LP and Education Committee.
No.
No new business. The Finance Committee, same being chaired by the treasurer now, Dr. Melissa Keene. We'll give an update to that. Business operations.
Thank you, Mr. President. We have nothing to bring forward so far.
Emergency practice and standards. Office of Nursing Workforce, Ms. Colvin.
We have nothing to bring forward at this time.
Again, Ms. Johnson spoke of this earlier, the NCSBN virtual annual meeting, August 12th. If you have not registered, please get them to get registered for that conference. Delegates Sandra Culpepper and Tina Highfield, alternate delegates Mary Stewart and Priscilla Burks. Number 8, we're actually going to postpone until the October meeting. We're going to do it today, but a few things came up, so we're just going to wait and do it. Any other business? If not, I have motion to adjourn. Ms. Collins, second. TJ. All in favor? Aye. Any opposed? Motion